A very good morning to all. Today I am going to discuss about hematological test, or otherwise it is called serological test. That means to study about blood, and that is too much important for the diagnosis of the disease and disorder. And that is hematological test or serological test, and that is the artificial handwriting. So I am back with my original handwriting or natural handwriting, that is this one. Serological or hematological test. Blood is produced from bone marrow, and it is, if you see the pH is 7.4, means basic, and it is the connective tissue. And blood is stored in spleen. Spleen is otherwise called blood bank. And if you say about that, it is present in our body 5 to 6 liter. And blood is mainly divided in two parts. One is corpuscle and one is plasma. So 60% is plasma and 40% is corpuscle. Plasma, if you remove from plasma to fibrinogen, that is minus sign is there. If you in plasma there is fibrinogen is there. If you remove fibrinogen, then it will come serum. That serum is too much important for the biological investigation or serological investigation, or otherwise they call it a hematological investigation. And corpuscle, that is again three division is there, that is RBC. RBC means red blood cell. It is otherwise called erythrocyte, and it is present about 50 lakh or 5 million. If you see lifespan, it is 120 days. And next, number 2, that is WBC, otherwise called white blood cell. It is otherwise also called, that is leukocyte. And if you say, it is present about 10,000 in our body. And if you say about lifespan, that is 4 days. And third one, that is platelet, otherwise called thrombocyte. That thrombocyte is present about 2 lakh in our body, and it is lifespan is 7 days. And that is too much important for the medical student as well as paramedical student and laboratory, means the lab technician. For them it is too much important. And one more important thing, that is RBC. In that RBC there is no nucleus is there. If no nucleus, there is no DNA and RNA. And RBC otherwise called erythrocyte. So erythrocyte, if you normal erythrocyte, that is erythrocyte is more in our blood, means erythrocyte is more synthesis, that is called erythrocytosis, and it is less than required, that is called erythrocytopenia. Cytosis and synthesis, if it is erythrocyte more, that is called erythrocytosis, and when erythrocyte is less, that is called cytopenia. And one more important thing, that is erythrocyte sedimentation rate. Erythrocyte sedimentation rate, it is associated with infection. If erythrocyte sedimentation rate is more, we have to consider that is the infection is there. Then infection is pathological infection. This pathogen may be bacterial infection, viral infection, parasitic infection. And that is WBC, white blood cell, or otherwise called leukocyte. Leuco means leukocyte. Leukocytosis, when it is produced in more, that is called leukocytosis. And you can relate with cytosis and synthesis. When leukocyte synthesis is more, that is called leukocytosis. When it is less, that is called leukocytopenia. And third, that is platelet, otherwise called thrombocyte. And thrombocyte, when it is produced in more in our body, that is called thrombocytosis. That is a pathological condition. When it is less in our body, that is also pathological condition. In case of dengue fever, that time thrombocytosis is decreased, means that time it is that is thrombocyte level is decreased. In that condition is called thrombocytopenia in case of dengue fever. thrombocytopenia is associated with dengue fever. And WBC again classified into two, that is granulocyte and agranulocyte. WBC again divided into two, that is granulocyte and agranulocyte. In that granulocyte there is again three division is there, that is neutrophil, eosinophil and basophil. Phils means loving and eosino means red in color, that is eosinophil. And this is the shape of neutrophil. And if you say the word percentage, that is 40 to 75%. And when it is more than 75%, that is pathological condition, or less than 40%, that is also pathological condition. If it is increased, that is called neutrophilia. When it is decreased, that is called neutropenia. And when this value is increased, that time we should consider that is associated with the acute infection. And when it is and if you see that about the eosinophil, when that is the normal range is 1 to 6%, and it is associated with allergic reaction and parasitic infection. When this value is increased, it is when it is more than 6%, that time we should consider that is the infection may be allergic reaction, or the infection come from that parasitic infection. And that is the shape of eosinophil. And basophil, that is present in our body 0 to 2%. And when it is more than 2%, that time we should consider that is a pathological condition. In that pathological condition, that is associated with inflammatory response and allergic reaction. Allergic reaction mainly type 1 hypersensitivity reaction. We know hypersensitivity reaction is 4 types is there: type 1, type 2, type 3 and type 4. And that is type 1 hypersensitivity reaction. And if you see about granulocyte is completed, and agranulocyte, otherwise it is called non-granulocyte. It is divided into two portions, that is lymphocyte and monocyte. Lymphocyte is responsible for immune response, and when and monocyte is that is for, and monocyte normal range 2 to 10%, 2 to 10% for monocyte. When it is more than 10%, that is called monocytosis. Cyto means cell, cytosis means increased cell number, that is monocytosis. And it is normal range is 2 to 10%. When this more than 10%, that time we should consider that is associated with the chronic infection or inflammation. And if you say about lymphocyte again divided into two portions. One is B lymphocyte and one more is that is T lymphocyte. When lymphocytosis means increased number of lymphocyte is produced in our body, that time it is called lymphocytosis. Cyto means cell, cytosis means increased lymphocytosis. And it is normal range is 15 to 40%. When more than 40%, that time we should consider that is a pathological condition. If more than 40%, that time we should think about that infection may be associated with viral infection or chronic infection. And here also that is monocyte is when the monocytosis, we'll see that more than 10% of monocytic value, that time we should consider that is associated with chronic infection. Thank you for watching this video.